I'm Dr. Keith Churchwell, President of the American Heart Association, and we're in Chicago at the American Heart Association's Hypertension Scientific Sessions for 2024. I'm going to have my friends introduce themselves, major scientists and who have actually played the largest role in actually putting this particular 4 days together. I'll start to my left.
Hello, I'm Wanpen Vongpatanasin. I'm a cardiologist and a chair of the clinical program of the Hypertension 2024.
Hello, I'm Tu Lei. I'm a nephrologist. I am the chief of nephrology at the Division of Nephrology at University of Rochester Medical Center. And I am chair of the KCVD Council and also a member of the planning committee for this meeting.
So the both of you have spent actually probably the last year trying to put these 4 days together. What should we expect to hear, and what are some of the exciting programs we're going to see over these next 4 days?
Thank you. So I think for the start of the clinical program, we have many exciting programs. We'll have a discussion on how to incorporate social determinant into cardiovascular risk assessment and perhaps incorporate into hypertension treatment for the first time. So I think I'm looking forward to hear the pro and the cons and how we would use that in treatment of hypertension. And also we have also a lot of in-depth discussion on the role of nutrition on cardiovascular health, particularly hypertension, or the role of a DASH diet in the past decade that have influenced the treatment of hypertension and the new emerging markers like microbiota. And also, so also excited to hear about more on the hypertension management on the impact on brain health. Actually, there is a recent I sprint my follow-up and with extended follow-up. I'm looking forward to hear more from the expert in the field as well. And it's also there is also more discussion about a new drug and new intervention that can be incorporated or potentially be used in hypertension treatment in the new in terms of endothelin and aldosterone synthase inhibitor. So I'm excited to hear about that.
You touched on a number of topics, though, that actually would have a major impact on actually a larger population. From a resource perspective about the treatment of hypertension, are we going to be hearing more about that and in that particular regard? And will there be studies that will be presented that will speak to the overall success or non-success or the utilization of these resources in larger populations?
Yes, so I think that there are a number of sessions as well, and new emerging studies on how to manage population health from using, now we have more like telemonitoring of blood pressure, how to reach patients in the rural area, and we'll hear about the efficacy and the outcome in terms of treatment. And also, we also not only focusing on population health in the US. I'm excited there's a session at the main session also on hypertension without borders. So we'll hear about challenges in management of hypertension around the globe, and also with the new guidelines from European Society of Hypertension that was just released, we'll hear about the guidelines leaders in that space as well.
Oh, great. Wonderful. I know you spent quite a bit of time over these 5 months actually trying to put this together. From your perspective, what are going to be some of the highlights that we're going to hear about?
Yes. Well, so I can certainly speak on the basic science side about the development of our program. We have some amazing plenary speakers. The first one is Dr. Ben Humphreys, who will be talking about transcriptomics in kidney disease. And then Dr. David Harrison, who has been a trailblazer in the area of inflammation and hypertension. He will also be giving a plenary session. And being a little bit kidney-centric as chair of the KCVD Council, we also have some awardees that will be presenting, particularly Don Selden lecture on, that's Dr. Tenzing Yang, who will be speaking about the role of prorenin in the collecting duct in hypertension. And then thematically, with respect to health equity, our mid-career awardee for, of course, KCVD will also be speaking about hypertension, how it's a different disease in different populations, and focusing on health equity aspect of hypertension in her talk. And then I'm very excited about our KCVD symposium, which is about ApoL1. It's a story that actually began in 2010, discovered by Dr. Pollack's group, that has really changed how we look at hypertension and kidney disease, particularly in African American population. And so we have three fantastic speakers who will be talking about the evolution of our understanding mechanistically, as well as from an epidemiologic standpoint, as well as drug development with respect to the treating patients with ApoL1 carrying the high risk allele in hypertension and kidney disease.
It sounds like a really fascinating and interesting next 4 days. If I was a young scientist, young clinician coming to this meeting, what would you say would be the one or two things that you would want to ensure that they take from these next 4 days of all these great lectures and opportunities to invest in time and effort with these amazing scientists and clinicians who are going to join us?
I think that I would love to see a more excitement on the hypertension field and how it could be useful not only for research and clinical care, but also for networking. That's also a session that dedicated to young scientists, postdoc, in terms of how to write good grants, how to write good papers. And there's also a TAC session, a trainee advocacy committee-led session by Dr. McCarthy, who has been an exciting session and well attended from the trainees and early career faculties in networking, and also get mentoring from more senior researcher. I think that should be very excited about that.
Great, fantastic.
I also think that for the trainees particularly, they should view science as a marathon and not a sprint. And that they can see how, someone like me, when I started out as a fellow in 1998, my first time that I visited that I attended this meeting, how my career has developed, how other senior scientists, how their careers developed, and it was coming to this meeting that really sparked our scientific curiosity, as well as being able to network, as was mentioned earlier, and developing lifelong friendships as well with their colleagues. I think that these have been really the inspirational times for me as a participant of this meeting.
Well, I personally look forward for the next 4 days. It's going to be an exciting time to be an AHA volunteer and also a young scientist, and maybe even an older scientist or clinician to join us for this meeting. Look forward to seeing you all here in Chicago.